I came to do a fellowship. At that time, I was really interested in biopsychosocial problems, and obesity, I was told, was one of the biggest public health problems in the state of North Carolina. And that's why I chose to focus my research on that. Weight is a really sensitive subject. It's a very stigmatized area in society. And I think a lot of pediatricians worry that when we screen for children's weight, we may come across judgmental. And that's the last thing we want. We care about that child's health. So many parents have questions about feeding and activity. So it's a really good area where we can partner with parents, and yet pediatricians really didn't feel very effective. So most of my work has tried to develop tools for pediatricians and ways to make those conversations go better. Do you have any concerns? Pediatricians needed a way to understand what families were eating and whether they were active. About how is he playing, and I talked with Sebastian. And so with health promotion and disease prevention, we developed something called Starting the Conversation, which is a tool that basically we give families in the waiting room, and then by the time the pediatrician is seeing the family, we have a good sense of some of the behaviors.
What is exactly the things he needs to eat more? Good things, sometimes it's...
Watch TV.
You watch TV. So one of the tools we developed early on is something called the color-coded body mass index chart. In the black and white version, these are really hard charts to understand, and particularly for parents. And so what we did is we color-coded it. We measured Sebastian. We found out that he's right here in the yellow zone, okay? So it's like a traffic light where green is good to go. Yellow is we slow down and we kind of think about... Turns out these body mass index charts, when we color code them, they're a lot easier for parents to understand.
And it's really concerned for me that he's in yellow.
We've developed a lot of other tools, especially for low literacy, low numeracy parents. One of the things that we've done is we've shown them the size of a plate that a toddler should be eating from, and what portions of food are generally appropriate for a toddler. When we equip pediatricians with these tools, they're more effective in their practice. These conversations are easier, they have them more often, they feel more confident.
Immediately he comes to home, he wants to turn on the TV.
One of the things we found is that we were able to change weight perception of parents. Parents had a more accurate perception of whether their children were overweight. But much more importantly than that, parents also were engaging in much healthier behaviors.
But he's more active because there's another baby there, so.
They were giving less soft drinks and sugar-sweetened beverages. They were giving lower fat milk. They were making sure their children were more physically active. We're actually trying to prevent obesity starting really young. We enroll parents of 2-month-old children, and we follow those babies until they're 2 years old. And at every well-child checkup, we teach the residents how to help the parents with habits at that period of life. So we teach them not to start watching TV when they're 2 months old, and we teach the parents to try not to put juice in the bottle.
In English, it's "I'm sweet enough, no juice please."
These habits that start early in childhood, they can last a child's lifetime, and they can be really important. So when you have a friend sleeping over today, what do you think about going outside and playing basketball?
That's a great idea.
It's a great idea. We want to partner with parents, and we want to make sure that those conversations go smoothly, that they understand the importance of this, but that they also keep their children healthy throughout their lives.